Dear colleagues, my name is Denis Borsuk, and in this short video I will show you how we do CLaCS procedure, cryo-laser cryosclerotherapy. So our first acquaintance with the CLaCS method was in 2017 when we first time met Kazuo Miyake and his clinic and his meeting, IMAP, International Meeting of Aesthetic Phlebology. And we were really interested of this method at that time. And then after 3 years of visiting of his clinic and his conference, we believed in this method and bought the equipment for this and started to do CLaCS and really satisfied of this method. Moreover, this method nowadays in Russian guidelines of aesthetic phlebology, and we're really proud of this because it's a very, very interesting document, and it gives us opportunity to work with this method in Russian clinics. So one of the most important thing in CLaCS is the settings for procedure, and in the next video I will show you our settings in our clinic. Dear colleagues, my name is Denis Borsuk, and in this video I want to show you our settings and how we do CLaCS procedure. So firstly, I want to show you the settings in our room for CLaCS therapy. Here is the standard cabinet, standard room. And we have here, as always, for CLaCS therapy, following Kazuo Miyake's protocol, which we have been using for last year. So here we have a photo camera, which is extremely important for CLaCS. So when we do a picture, these pictures are going to this screen. And when we have follow-up procedure, so before we start second procedure, we do again pictures, and they are going directly to the second screen. So, and the patient can immediately compare before and after. It's very important. Patient is lying here and can see pictures. In any positions, on spine positions or in any position, patient can see the pictures. That is why there's these screens standing here in this side. So also, as I told you, we have a camera for pictures, screens for pictures. Also, we have a Zimmer machine. It's a cooling device, which is very important for CLaCS procedure. Of course, we do have a Venous, and I will show you. It's augmented reality. Very important to find feeder veins, not to miss them. And of course, we have an ND-YAG laser machine for CLaCS therapy. So now I will show you how we doing procedure. So as I told you, one of the most important thing is picturing of the leg before and after. And as it was investigated by my friend Fabrizio Santiago, that when you show the result for patient with the pictures before and after, you can rise in his satisfying of the result. It's very important. So having said about CLaCS, so let me show you in the pictures how we do this. So our first step is treatment of reticular veins, of feeder veins. So we do with the standard settings of laser from 2 to 3 passes for each vein with the laser, and of course every time we need to have a good cooling of the skin. So the state settings, it's very easy. That state settings is the same for reticular veins and for spider veins, for telangiectasias. It's 15 milliseconds impulse, 6 millimeters spot size. Fluence is approximately 70 joule per centimeter, and you can decrease fluence for 50 joule per centimeter in case of when it's painful for a patient. So, and after the percutaneous laser, you need to immediately inject 75% dextrose, because vein has less diameter, and it is inflammation of the venous wall, and you need to inject very slowly dextrose 75%, which is
quite a very good sclerosant, but not so strong as detergents. So here is injection of the reticular veins. And after, you need to repeat the same settings, the same laser, but only 2 passes, not 3, only 2 passes. We use just 2 passes for every telangiectasia and ectasia, spider veins, and then you need to inject the same dextrose to that veins. Very easy, and after you can have very good results just after 2 to 3 sessions of the CLaCS. But when we started, we thought that after 1 session you will have every time good result, but it's not true. In majority of cases, we do 2 sessions of CLaCS. But some of patients want to have better results, and we can do 3rd session. So nowadays I work in 2 cities, and it's 200 kilometers between them. And to be honest, I do sometimes sclerotherapy still in 1 city, but a lot of patients who heard from me the words like, your legs is so beautiful, I cannot do sclerotherapy for you. I cannot harm you, so make some hyperpigmentations or matting. I need to be sure that you will have very good results with very low risks of some complications. And you need to go 200 kilometers to another city to have this procedure. So I really believe, without any comparative studies nowadays, having just my experience, that this is quite a good method. And in the nearest future, we will show you that it really works, and you can have very, very low complication rate without mating, without strict complications, strong hyperpigmentations. So we're really satisfied and lucky with this method today. Thank you for your attention, and I hope it was interesting for you.